So, I thought it would be good to produce a little video on Ledderhose disease, a quick start, which will be my story, and then this will be followed by a little bit about Ledderhose treatment. So, for me personally, I found a small lump when I was around 13, and this didn't cause me any problems, and I basically ignored it. This lump in the arch of my foot then progressed when I was around 22. This happened when I was out running in a cross-country environment, and I noticed a gradual increase in the pain and in the size of the lump. So I went to the GP, and he thought it was probably a plantar fibroma, so he did have to look this up. I then went to the foot specialist, and they said I should have a steroid injection, and this gave relief for a little bit of time, but I will go into that in more detail later. I then found that pain increased further and obtained custom orthotics on the NHS, and these are designed to distribute the weight, although again I'll go into that further later. And over the past couple of months, so February 12 to April 2012, I've again suffered from a huge increase in pain, and this has coincided with an increase in the size of the lump, which I've tried to show here in this picture, though to be honest it's not crystal clear, but this varies from patient to patient, and the size of the lump doesn't always correlate to the amount of pain, and vice versa. So hopefully this video will play, and this shows that in my left foot I have a lack of flexibility in the toes. So as you can see, I can't bend anywhere near as much as the toes in my right foot. Although this may not seem significant, I think it does contribute towards the pain, as when you're walking you are forcing your toes to bend. I've also, with a fellow patient, helped design a Ledderhose disease leaflet. I'm passing this around to try and increase awareness, and hopefully this can lead to better treatment in the future. So, I'm going to briefly now talk about Ledderhose treatments. I'm not a doctor, but I have done lots of research, and I hope that this information is correct and up to date, but do listen to your doctor. So, Ledderhose disease treatments start with steroid injections, and then I'm going to cover orthotics, surgery, and radiotherapy. There are several other treatments. For more details, go to the Dupuytren Society page, or Dupuytren's, however you want to say it, and also my blog, but this will probably just eventually direct you back to those other pages. So, steroid injections, the idea is that they're normally the first line of attack, because they're generally speaking not going to make it worse, and they should help reduce swelling and therefore reduce pain. But the results, generally speaking, aren't that good. Going on my experience, and going on experience of those that I've heard from, it's not very effective. I've actually heard from a case where it was made worse through steroid injection, and at a recent specialist appointment I was told that he doesn't consider it a good treatment option, and would generally speaking not recommend to have it, as he sees it as a waste of time and that other treatment should be prioritised. So that's steroid injections. So now I'll move on to orthotics. So these are basically insoles that you put into your shoes or your trainers, and these help distribute the weight around your foot and try and take direct pressure between the shoe and the lump, and indeed the general strain going through the lump, and this should help reduce pain. In theory it's a great idea, but it doesn't always work. For me it helped for a little while, but this did coincide with a decrease in walking. So hopefully here I've got a video that displays how they have been working. So one of the problems I've got with my feet is that I tilt over a lot to try and distribute the weight off of my foot naturally. And this is shown here with me walking barefoot. So if you look at the angle at which the left foot, which is the foot with the lump in, hits the ground, you'll see that it's quite an angle leaning towards the little toe. And this causes a variety of problems and other pain. So I also have pain down near the little toe, and though this isn't that big. So before I got orthotics, I was mainly using running trainers, and to be honest, these seem to completely crumble under the sideways pressure, as you can see from this picture here. So as I walk, they just completely twist sideways and offer very little support. So these are now then the trainers without orthotics. So these are quite big, and so it's actually quite hard to see the twisting going on. But I can tell you personally that it wasn't very comfortable, and that my foot, at least at the level shown there, the ankle, it is still twisting and it is still going sideways. However, if you then look at me with the orthotics on, this problem clearly is resolved. So my ankle's straight, my foot's straight, but interestingly, these orthotics also worked in shoes, but they didn't help in the running trainers. Whether this is due purely to the lack of support in the side of the running trainers, I don't know. But they certainly didn't help me at all in running trainers, but they did in shoes, and they do in normal trainers. So these will help some people, and they're certainly worth trying before having surgery, which is the next option I'm going to talk about. So surgery is normally considered as a last-ditch option. There are several different types of surgery that you can have, and these, generally speaking, have a high rate of it coming back or major complicating factors. So the first type of surgery is where they purely just remove the lump or lumps in your foot, and these have a huge chance of coming back and coming back worse, because the lump is essentially formed of what is scar tissue, in more or less, and so by cutting it out you create more scar tissue, and so it grows back. In fact, it grows back at least 50% of the time, and I've seen some very well referenced and very well researched articles claiming it's up to 80%. So it certainly isn't the best option, and I've interviewed several people who have had this, and they certainly say to avoid it, and a lot of places say to avoid surgery. Another option, which is probably becoming increasingly popular over to the minimally invasive surgery, is to cut out basically the entire tendon, the entire plantar fascia in the bottom of the foot. This obviously then leaves no tissue to have regrowth on. However, it's there for a reason, and it's a very important part, and load bearing occurs through this part of your foot. So you will have to wear orthotics, and you're potentially going to have other problems with your feet. So it's very much worth considering all other options before going for surgery, because you can't take it back. And most other options have minimal risk, and you can just stop using them or take it back. And so I think, generally speaking, surgery is becoming less and less of a recommended option by the top people in the field. So one option that is becoming more and more recommended is radiotherapy. So radiotherapy works in a very similar way to cancer, and this is where it hopefully targets the disease cells more effectively than healthy cells, because the disease cells are replicating fast, so the damage that goes in is more likely to then cause these cells problems rather than the healthy cells, which generally speaking are sitting there not doing a lot, and so have time to repair this damage. Obviously people mention cancer will think radiation and cancer. The increased risk of cancer is minimal from having this treatment in your foot. So I'm a 25-year-old male, and from research that's been done and statistics that have been posted, the increased risk is thought to be about 0.1%. To put this in context, the risk of an average 25-year-old male going on to develop cancer is 24%. So it goes up from 24 to 24.1%. So for someone that could potentially have huge benefits, it's well worth, in my opinion, the risk. But obviously consult your doctor and do your own research. So does it work? I've interviewed many patients that have benefited from radiotherapy, and they say although it often takes several months, the lumps generally soften and quite frequently will become a bit smaller. And most of the long-term and short-term results that have been posted in journals and in books have suggested that the success rate could be as high as 66% over 13 years. And this was patients that were, this is mainly actually in the feature, the hand version, as opposed to in the foot. But the foot version, the results in the feet are showing also good success rates. And the 66% shown here, I believe, was a case of having not progressed to the point of needing surgery or even having improved. It combines both of those aspects. So there are some other treatments. These include cryosurgery, where with its nitric oxide is used at obviously very cold temperatures, and basically you freeze the nerves, and this then causes a decrease in pain. It's obviously not ideal because it's not a cure, you're not getting rid of the lump, you're purely just blocking the pain, and if you have multiple lumps or the lumps progress, this isn't going to help. And another one which, as far as I can tell, has had very limited success is Apamil. And this is basically a gel that you rub on, and it's supposed to block calcium channels, and calcium is very important for the production of collagen. And as I'll probably do in a later post, or have mentioned in previous posts on the blog, calcium is very important for collagen production, and collagen is the main part of these lumps. So that I don't ramble on too much, I'm finally going to say be sure to visit the British Treatment Society. Also, I'd like it if you could visit my blog. I have lots of information on there on treatments and just on how I cope with it. And also the International Depression Society Forum. Here they have a wealth of information, lots of experience, and they've been incredibly helpful. And certainly it's worthwhile visiting them.